What we have to do now that President Trump is on his way to his second term is we need to talk about how to reform healthcare in a major way. This is perhaps the first opportunity we've had in 100 years to really fix the horrible problems with healthcare. We have an overly politicized healthcare system, a politicized science system, where massive funding is paid out to big pharma. We used to spend about 2% of our gross national product on healthcare. Now we spend up to 17% on our healthcare, and we're less healthy than we were. In fact, lifespan in the United States is actually on the decline, especially for men. I want to talk about some things that I'm hoping that RFK Jr. and hopefully all the new folks that President Trump is bringing in are going to do. Let us start with one of the things that most impressed me about RFK Jr. He's a very flawed person. There's no question about that. Everyone is flawed, aren't we all? But I just have to say that the things that he said about seed oils, he knows about seed oils. He knows about this. PUFAs, polyunsaturated fatty acids, are responsible for the obesity epidemic, for the diabetes epidemic, for the lower lifespan of people. Now, we're talking about corn oil, soy oil, peanut oil, all those seed oils. They're terribly toxic. They're polyunsaturated fatty acids, PUFAs. And actually, if you look at what the government has been promoting, they've been promoting PUFAs and they have been discounting and telling you how bad saturated fats are when it's the opposite. As usual, the government is telling us exactly the wrong thing. Now, I will in another video be talking about fish oils. Fish oils are very toxic, very carcinogenic. I would never eat or use fish oil. Before I knew better, I used to give fish oil to my dogs, and I had 3 dogs that all died of cancer. And I think it's because of the fish oil. The things that we give our chickens contain high amounts of PUFA, soybeans, corn, same thing with pork. The pigs, they eat all that stuff. That's why I don't eat pork. I don't eat any chicken fat. I avoid that. If I do eat meat, I'll eat beef, lamb. I don't really enjoy goat too much, but I would eat goat. And that's because those fats are almost fully saturated because the animal has multiple stomachs and saturates the fat. So even though they eat PUFA in the grass and things like that, the fat on their bodies is saturated fat. And so we can safely consume that. We don't and can't safely consume polyunsaturated fats in any quantity at all. If you think nuts are okay, nuts might be okay once in a while, but we're not intended to be eating nuts 12 months out of the year. And I don't eat nuts. I think nuts are very toxic, actually. There's a lot of study about that. The only nut that is relatively safe is macadamia nuts because it's very low in PUFA. Okay. Next thing, let's get some legislation in place about PUFAs and seed oils. I want to get them out. I want them replaced with fully saturated fats, coconut oil, fully saturated coconut oil, butter, things like that. I don't want to have any vegetable, and I never eat anything with vegetable in it. Second thing, let's end the liability shield for vaccine manufacturers. There is a bill. We can do it. End the vaccine carve out. I personally will never get another one as long as I live. There's just too many problems with them. They're almost never safety tested, really, to my satisfaction. You would not believe the fact that there's almost no studies done that are legitimate comparing vaccines with somebody that is given a placebo. The placebos are always full of fishy stuff in them to make the vaccine arm of the test look good. If you test against no vaccine and salt water, the vaccine arm looks really bad. So what they do is instead of giving the placebo arm salt water, they give them dangerous things, and they justify it in gobbledygook. So the studies are never valid. They're just terrible. And it's just wreaked havoc in America. And as a result, we have so much autism in this country. So much autism. Do you really think that there's no link between autism and vaccines? Really? I can tell you that there is, having children myself. I can tell you there certainly is. In 1983, we gave kids 10 vaccines. In 2022, 74 vaccines. It's crazy. It's crazy. Autism rates in 1983, 1 in 10,000 children were born with autism. Now it's 1 in 36. That's crazy, okay? And it's terrible. And there's got to be a reason for it. And don't think that you're going to get the truth from the media or so-called scientists. Everyone's on the government payroll. The old days, research was done by drug companies. Today, all the research is done by public funding. And then when something's good, the big pharma buys it out and patents it. It's a very unfair system. Next thing I hope that they do, let's end fluoride. They have said that they're going to take action to eliminate fluoride. There's been a court ruling Eventually, they'll get fluoride out of our water, this terrible poison. I don't, I'm not against fluoride. If you voluntarily want to fluoridate your water, fine, have at it. Okay. I personally sometimes advise people to use a little fluoride topically on their teeth. Nothing wrong with that. But there's a lot wrong with swallowing fluoride and having it in your whole body. It suppresses thyroid. It lowers intelligence for children. It causes an epidemic of diabetes type 2. The anti-fluoride activity is just terrible. It's already been known. We know this. We've known this forever. And we had to buy these expensive filters to filter this poison out of our water. Let's end that at once. Next thing. There's so many promising therapies that are illegal, that have to be sold by shady ways of selling, where people can't even get a merchant account, so you have to pay with Bitcoin or crypto because they can't get a bank account. Let's make peptides and everything legal so anybody can buy whatever they want. In the old days, there wasn't a lot of information out there about things. So if somebody wanted to buy something, they didn't know what they were getting. Now there's the internet. We all can do 5 seconds of research and decide if something is safe or not for us. Let's make everything legal, especially peptides, especially things like DMSO. All this stuff should never be regulated as drugs. It's insane. The reason they want it regulated like a drug is to perpetuate the monopoly of big pharma over all of us. Let's end that immediately. Let's make every compound, everything legal, and stop harassing people that are selling these things. Let's leave it to the consumer to decide. Yes, there will be people that take things in dosages and amounts they shouldn't and all that. But just look at the marijuana industry in the United States and Canada. You get a certificate of analysis showing you what's in the thing. There's no big deal, okay? Let's just mandate that, okay? Make people test their product before they sell it to consumers. Yeah, you can sell whatever you want. Just test it. Give the consumer an analysis of what's in there. That's all I would want to do. Then we can make informed decisions if we want to take that or not. It's our decision, not the frickin' government's, okay? Last thing, let's legalize one of the most miraculous herbs ever put out here by the good Lord, which is cannabis. There are so many benefits of cannabis. If you go to Cannabis Health Radio, I've interviewed Corey Yellen here in my private students. Amazing person. She and her co-host, incredible people. They're doing such good work. If you want, you can look at time after time where cannabis has cured people of brain tumors, ovarian cancer, breast cancer, prostate cancer, and that's so many things. There are so many incredible miracles. I personally have seen these protocols work, and I've interviewed people, and I've had hands-on use of them. I'm not a doctor. I'm not your doctor. I'm not telling you not to go to the doctor. I'm just telling you that we should legalize everything to do with cannabis on a federal level. Then the states can legalize it or not. That's up to them. I believe in the system that we have of government where the states are sovereign, and that's fine with me. But on a federal level, let's make everything legal. Okay, because there are so many benefits of this. It's just unbelievable. Unbelievable. I don't worry about things like cancer anymore. I've seen how giving somebody CBDA can fix their symptoms for anxiety. It lets somebody who couldn't tolerate coffee, now they can tolerate coffee. They can sleep well. They don't have to take dangerous benzodiazepines. There's just so many things about it. And if I had cancer, I would just use cannabis myself, and I'd use ultrasound, and I'd monitor the tumors and watch them shrink to nothing, hopefully. And if they weren't, then I could go ahead and get some other more radical interventions. But everyone should have the right to do with their body as they please. That's my message here. Matt Cook. So if you want my daily newsletter where I analyze studies, and I have a book out that's just coming out, I'm going to send you a review copy for free. Go to dailymedicaldiscoveries.com and join my list. It's mainly for men, but women love it too. I also work with Dr. Ari McGill, a physician, who works with me. And you'll be on his list, and you'll get his analyses of studies and so forth. This is stuff that you will never see anywhere else. Very good. Glad you're here. Please, this video, subscribe to my channel. And if you want to turn the bell icon, you'll get an alert when I have a new video out. It's just vital. And leave a comment, a question, anything that you want. I've coached over 80,000 people over the years. I'm doing a lot of podcasts now. I'm getting out there more. So you'll probably be seeing a lot more of me, which I think you should count yourself lucky for. You're going to thank your lucky stars. Seriously, I have. I just think we're doing a lot of good work here, helping people with health, with stuff that they wouldn't otherwise see. I'll just give you a couple of things I got recently. Thank you. You're such a generous man. By using information that I got from you, I was able to help my mom with her heart issue. She had coronary disease, After the latest scan, seems like there's no blockages anymore. Okay, that's just diet, a few supplements, nutrition. Another one says, given what you just said, I must have low T. And after reading your earlier piece, I stopped taking the candesartan and immediately my blood pressure dropped and virtually normalized. I never advise people just to stop taking something. You should have your doctor take you off of those. But I want to make it so you don't need them. So your doctor does take you off them. Bought the A9. I've talked a lot about PEMF, and Dr. Robert Dennis, the professor at University of North Carolina, Chapel Hill, a brilliant man, a fantastic man, has patents on this, landmark research. Switch between the painful sacroiliac penis and prostate essentially every night, helps with pain. Great success in returning penile sensitivity and reduction in prostate enlargement symptoms. Just keep going, man. You're gonna find it just gets a lot better. Another one, I follow the fat depletion diet. Last year, my eyes changed color from brown to blue-gray. I originally got glasses for driving. I could see the road, but the instrument panel got blurry and I couldn't see the numbers. No, I've noticed lately I can read the instrument panel numbers clearly. I went to an optometrist and he said the old glasses were 2.75, the new ones are 1.5. I credit your course for improved vision. I could just go on and on, okay? The only med that took for years was albuterol, which is like a rescue inhaler for my asthma. I don't take that anymore, thanks to your oxygen transformation. Oh, on and on. This is what you want to do. You want to be able to use protocols like this so that your doctor can take you off your medications because you don't need them anymore. That's my theme. That's what we strive to do here at dailymedicaldiscoveries.com. Join me. Thank you so much. I'm very excited about this administration. With all the people that are joining, so far the signs are very good. And we're going to work really hard to help you with these protocols so that your doctor can take you off all your medications and that you can live to 120. I like to tell people I meet, since I believe we can live to 120, I will see you at 120.